Is your home care agency losing money because you haven't educated your staff to chronic diseases? It's a common problem, even in established agencies. Meanwhile, your competitors who have experience and expertise in treating patients with chronic ailments, such as heart disease, cancer, diabetes, and COPD, are getting more referrals for individuals, siphoning work from your agency. In the past, nurses were the ones educated to different chronic diseases and the care and curative measures to resolve the disease or stabilize the patient. That was how we did things 40 years ago. But now, with home health budgets growing more constrained, certified nursing assistants, who see patients the most, are assuming a greater role in the overall care of patients. However, education did not follow this increased use of these valuable caregivers. It's clear that everyone on your team needs to speak the same medical language and be aware of the signs and symptoms of an impending exacerbation of a chronic disease. Since your agency's CNAs are the ones who have the most contact with patients, you can avoid many preventable rehospitalizations if your nurses are educated to chronic diseases and know the yellow and red flags around each ailment. This is especially crucial in an era of increased Medicare scrutiny. For context, the cost of hospitalization averages about $3,000 per day, according to the American Hospital Association annual survey. You should know that cost-conscious, accountable care organizations are looking for partners who can prevent rehospitalizations for chronic diseases. Accordingly, all of your caregiving staff, including nurses, therapists, and home health aides, must be certified in the diseases they are dealing with. They'll be better able to recognize exacerbations in the early stages that allow treatment at home before an emergency room visit. At minimum, your staff should know what is the disease, how is it diagnosed, including what tests are done initially and what tests are done routinely to monitor, what are the major treatments and medications to manage the disease, and what are the yellow and red flags that patients may present if they are heading to an exacerbation. And lastly, what are the care and comfort measures your home care aides can provide to patients with chronic diseases? Everyone, particularly your elite team of chronic disease certified aides, must know what to do and who to call when they recognize a patient is heading for problems. Failure to educate your staff to the chronic diseases may mean that the referrals you are currently getting will go to an agency that has demonstrated they can and do prevent hospitalization of those patients they care for who have one or more chronic conditions. The professionals at Kenyon HomeCare Consulting have decades of experience helping home care agencies like yours in educating their caregiving staff on recognizing changes in chronic diseases. For guidance educating your staff on preventing rehospitalizations due to chronic disease exacerbation, call us today at 206-721-5091 or visit the Kenyon Home Care Consulting website at www.kenyonhcc.com.